I'm good.
Okay, you have a couple minutes, or?
Of course.
Thank you so much. I know when we last spoke, it seems like an eternity ago. I think it was late January or something. When you were just
Different, yes.
when you were just coming on board, I guess, and it's a whole different world now. And I don't know if you were able to read I think the article that I sent you from Kaiser News.
Yes, yes.
It's some reporting on I guess increasing data coming back from where maybe one in five or 20% of COVID patients may have heart muscle issues or heart issues, possibly an infection, affecting the heart when it may not affect the lung. But so I just wondering if you had any your first impressions about this. And I know that there was they mentioned that the virus can infect the heart muscle. An initial study found cardiac damage in as many as 1 in 5 patients, leading to heart failure and death, even among those who showed no signs of respiratory distress. So, I don't know if you've had a chance to digest all this. And
oh, definitely. I've been working on it.
Oh, great.
But okay, so let me give you a little background. So, when the virus attacks the body, there are some cells that are more susceptible to others. So the main point of entry is the respiratory tract.
Right.
However, there's the GI tract that is also can be affected, and that's why some patients have nausea, vomiting, diarrhea. And the cells in the myocardium, in the heart, have some of the receptors that the virus can use to enter into the cells and cause some damage. It's not as extensive as in the respiratory tract, but it has been seen that the virus can also attack the myocardium. So that's why what we're seeing is that there are like 3 different pathways of the virus affecting the heart. One is what we call a direct injury, so it's affecting directly the muscle. Another one is when there's lack of oxygen because the virus is attacking the lungs. Then we have low oxygen, so hypoxemia and respiratory failure that can then lead to heart problems.
Right.
And the third one is that all that activation of the immune system, that hyperinflammation, can affect the heart.
Right. And then I think the article, I think I focused on the first one you mentioned, which was direct infection of the heart muscle. Is that right?
It's direct injury is what we would probably call it, because we don't really understand all the physiopathology.
Right.
So there have been some studies where they have looked at the heart muscle, like they do biopsies in some limited Chinese reports, and they didn't see the virus in those biopsies. However, when they do some of the autopsies, they have seen damage.
In the heart muscle, or in
yes, I'm talking about just the heart, correct?
Right. And is any of this? And I don't know if it's clear in this article but did these patients have underlying heart disease, or is it? I know that's
not necessarily. So. So there's so many reports coming up right now.
Yeah.
Mainly it was from China in March, but now we have from Italy, and then we have from Spain, and now from New York. So the percentage of patients that have some signal of injury in the heart, it can vary between 7 to 23%. I'm not talking specifically about this study. I'm talking about some studies that were published in JAMA and Lancet last month.
Right.
So, the patients who have risk factors, for example, prior cardiovascular disease, those patients have a higher complication with COVID-19.
Right.
So, if you have someone with, let's say, heart failure, coronary artery disease, vascular disease, those patients are more likely to have more complications.
Right. And I know in a study just I think earlier this week from the CDC on New York deaths, but the most common underlying health issue was high blood pressure, hypertension, which is
the common one, right?
Right, yeah, and it's yeah, and diabetes was I think the next one, but I mean that's that affects the heart as well. But so obviously hypertension affects the heart, and is one of these risk factors that we're talking about, right?
Yes. Yeah. So the problem is that because of the complexity of the care of these patients, the lack of PPE, sometimes we're not capturing the true damage to the heart. What we do is we do the cardiac enzymes. So we get a troponin level that will give us a sense of the degree of injury to the heart. But, the amount of the typical management that you will do in patients in this situation is that you do a cardiac MRI or an endomyocardial biopsy. But given the clinical situation during the crisis, that's usually not feasible.
Right.
So we are not getting the same amount of data that we would get in a normal situation.
Right, and that's that's unfortunate. But unless I guess the physician or whoever may know about an underlying heart issue, but otherwise this may happen to people without as well. I mean, without
right. And so the problem is that those patients, for example, that have underlying coronary vascular disease or heart failure that get the COVID and end up with a mechanical ventilator, those patients have one of the worst outcomes.
Right. Okay. Anything else from your end, from your research there
Well, there's another problem that we're seeing is that we used to have the hospitals full of patients with cardiovascular diseases, with heart attacks, with heart failure, and we're not seeing this during COVID-19 because the patients are staying away from the hospital. So a trend that has been seen in New York is that the patients are not getting into the hospital when they have chest pain or when they have signs of heart failure, and they call sometimes too late when they have cardiac arrest, and they will not even make it to the hospital.
Wow.
Again, because there's that fear of going to the hospital when you can get infected.
Right. And that's another unfortunate. Now, I hope it's not happening here because we're not as, situation's not as bad here in South Florida. Hopefully it won't get that bad, but you're not seeing that here, are you necessarily, or is that?
Well, we are not seeing the same number of patients that you used to see.
Oh, okay.
But again, we don't have the same data that we have in New York.
Right.
Obviously, the magnitude of the crisis is much bigger. But there's some trends that we're not seeing the same amount of acute myocardial infarctions that we used to see.
Right. And we hope that's because, I don't know, fewer people, it's actually that, or not that they're holding back and not coming in when they feel symptoms that may be heart attack.
Well, there are some other theories that, obviously these are just theories.
Right.
That patients are not as active or not exercising as much, they're just staying at home.
Right.
And they're less maybe stressors because they're not working. But, how can you say that when you have a high unemployment rate?
Right, yeah.
So these are just theories that maybe because of lifestyle changes. There's actually a new study that suggested that with less pollution, there's less risk of disease in general.
Right.
And we know that pollution has been associated with cardiovascular disease. So with the social isolation, we have less pollution, therefore less visits to the hospital. But these are just
speculation.
Yeah. Correct.
And the one good side about this, the less pollution, I guess. What would be your message to people in South Florida, for example, who may have heart issues and may be afraid to? But I mean, what would be your message? Obviously,
if you have cardiovascular disease, and even if you don't have any symptoms, we have now a very strong network of telemedicine where you can, from home, be in touch with your provider.
Right.
So from the safety of home, you can get similar level of medical care, and you can make sure that if you are not stable, then we can tell you to go to the hospital. But the important thing is to just make sure you have plenty of medicines, that you keep good communication through telemedicine with your medical provider. And if you have any symptoms, don't delay and always call 911 if you need to be seen in the hospital.
Fantastic. Anything else that I didn't cover? I think how's your how's your new role there? It's been a crazy start.
It's great because I have electronic access from home, and I have electronic access to video cameras.
Fantastic.
And I have, telemedicine. I can see my clinic patients.
Oh, fantastic. Fantastic. Well, thank you very much, Doctor. I appreciate it again. I will over the next few days I'll put something together, based on what we talked about and what's out there. And if you see anything written out, let me email it to me, please. If you see anything, any study or anything that may be of help.
I tell you, there's so many studies.
I know.
Much going on.
I know. I keep track, but maybe I missed one, and I know you're really really deep into that research. But
so what I can suggest is that you can go to some of the societies that have compiled all the trials, for example,
right,
American College of Cardiology.
Oh, okay.
One of them.
Right. Yes.
There's a really nice website called, maybe it's too specific for you, COVID-19ICUcare.com. There's also the AHA. They have a really nice website about COVID patients as well.
Great.
There's so many. It depends how much you wanna.
No. I do pretty good research about it. Yeah, I'll check out those two as well, and then I'll write something up over the next few days and email it to you. Make sure you look at it before we publish.
All right.
I appreciate it, and let me know if there's anything new that comes up that we didn't talk about.
All right. Oh, you know what? Something really important. There was yesterday the ACC actually released a report on the side effects of some of the medicines, hydrochloroquine and azithromycin, because these medicines, what they can cause is arrhythmia. So if you have an underlying problem and you take these medicines, you can go into what is called sudden cardiac death.
Right.
So that's something really important, that it's not a medicine for everyone to take. So I would probably highlight that statement from ACC.
All right, I'm looking at it. Okay, great. Yeah, I did hear about this yesterday, and I heard it was more than one group, the ACC, maybe the AHA.
Yes.
They came out strongly. So it's unfortunately there's a political debate here in the mix of this one. There shouldn't be, but anyway.
Right.
Yeah, I know. Thank you. I appreciate it. So we'll be in touch over the next few days. I appreciate it, Doctor.
All right. Take care.
Take care. Bye-bye.
Bye-bye.